Let's do example treatment plans that you might see in primary care. A patient who is already on valsartan, carvedilol, and recently had to come off amlodipine because of lower leg swelling, and their blood pressure is not well controlled. They also cannot tolerate hydrochlorothiazide because it has caused hyponatremia in the past. So an option for a patient like this is doxazosine, 2 milligrams once a day, which is usually used in men for BPH treatment. And yes, this patient has already been worked up for resistant hypertension. They just live a very poor lifestyle. A patient who has elevated blood pressure, pretty elevated, I'm talking 170s over 100, who has already been checking it at home for about 2 weeks. This patient also has some exertional twinges in the left side of his chest and palpitations, which then causes him to be even more anxious, and it kind of spirals. So for this patient, you want to do an EKG to make sure that that is good right there in the office. And that high of a blood pressure consistently at home and in the office, starting this patient on 2 different medications. So olmesartan, one of your ARBs, you could do 20 milligrams, and like 5 milligrams of amlodipine, tackling it from 2 different angles without maxing out on one medication tends to work a lot better. And then you can send this patient for a stress test or even a stress echo if the EKG is abnormal, and maybe contemplating propranolol to use as needed for that like anxiety palpitations. And when you see this patient again in 2 to 3 weeks, you're going to check labs because an ARB can alter electrolytes. Don't forget, amlodipine can cause lower leg swelling. Usually see it more so in the summer months, so just letting them know to be aware of it. A patient with UTI symptoms but is also having diarrhea and has a history of diverticulitis. Dipstick in the office is positive for UTI, and you're going to send out a culture. So ciprofloxacin can help 2 birds, 1 stone here, diverticulitis and a UTI, and also ordering CT abdomen pelvis with IV contrast to check for a diverticulitis flare, and then you can adjust treatment if needed. And this patient did have both UTI and diverticulitis, so we did Cipro and Flagyl and about 3 days of a liquid diet and follow up with GI. Okay, smoking cessation. So a good option is Chantix, where you titrate up on the medication over the course of the first few days, and then they are on 1 milligram twice a day for the duration of treatment. They can be on it for up to 12 weeks. If they have adverse effects, you can titrate back down on it, and some of those side effects are nausea, GI upset. Some people have crazy vivid dreams, and then there's also those psychological side effects like suicidal ideation, depression, irritability. So letting them know. And then once they've successfully stopped, a good option is to put them on Wellbutrin to help with those addictive behaviors.